Is the Director of Infectious Diseases at South Shore Health. Dr. Ellerin, we appreciate your time. We appreciate you being here and answering these questions. We're talking about people with weakened immune systems. Dr. Fauci staying away from calling them actual boosters. So what should we be taking away from this move when it happens?
Well, Maria, I think what's important is that what we're seeing is more and more immunocompromised patients, even if they're fully vaccinated, getting sick with COVID-19. About 40% of admissions with COVID-19 are usually in these immunocompromised patients because they don't develop those powerful antibodies that we normally do develop. So in light of that, I think the FDA and the CDC are taking the next steps, which are going to be to authorize an additional, you can call it a booster shot, you can call it a revaccination. I don't want to get caught up in the terminology, but it's going to be important to ramp up the immune response in the most vulnerable patients.
So, Dr. T, given that, let's talk about the wider population. The message seems to be not yet. So what are experts looking for when it comes to giving those additional doses, and what perhaps could raise red flags?
Right. So, Ed, if we start seeing a lot more of what we saw in P-Town, right, these clusters, these outbreaks, these super spreading events, that would be one thing that would be a reason to kind of broaden out the booster for the general population. But most importantly, I think what we're looking for is those vaccine breakthroughs. Are those just mild and asymptomatic or very minimal symptoms, or are they leading to hospitalizations and deaths?
Right.
What we know so far, remember, is that these vaccine breakthroughs rarely lead to death.
Right.
That's why we're doing so much better in our state right now when you look at deaths now compared to where we were in February. Much different.
The Provincetown was 0 in deaths. So, given the breakthrough, the Provincetown number was 0.
Yeah, right. So they rarely lead to deaths, but the numbers, we did see this increase in breakthrough cases just this week, more than 2,000 infections. So is that what you're expecting to see? I think we felt, okay, things are great. We're moving forward.
Get rid of the mask, right? Yeah.
And now we're back in it again, and we're just trying to wade our way through this.
So, Maria, let's do a very quick thought experiment.
Okay.
When you look at how transmission can occur, it's from unvaccinated people to unvaccinated people. That's the most. Then after that, it's unvaccinated people to vaccinated people, because we know there's some reduced effectiveness of the vaccine. Vaccinated people transmitting to vaccinated people, that's much, much less common. What's the key message here? You know what I'm going to say.
Vaccinate.
Please roll up your sleeves.
Yeah.
Yes.
Yeah.
The power of the vaccine.
That was laid out very logically, Dr. T. Thank you.
Thank you, Dr. Ellerin. Be well.
Guys.
We appreciate it.